Hello, if you're just joining us, my name is Tony. I am the head of community for Sana Benefits. Thank you so much for joining us for our broker roadshow webinar event. Uh, some people are joining in. I'm giving enough people to join us. I see some people are just joining us in right now. So please wait until we start. It'll be in 3 minutes. Thank you so much for joining us. Justin, we could see you moving around the presentation. Again, my name is Tony. I am the head of community for Sana Benefits. Thank you so much for joining us for our broker webinar event. We're very excited to have you all here. I see that some people are popping in. So we're going to give 2 minutes for us to see how many people we have. We are expecting like at least more than 35 people to join us for this afternoon. Thank you so much. While we are all waiting, I'm going to go ahead and release a poll that we would love for you guys to answer while everyone's settling down. Again, thank you for joining us. My name is Tony. I am the head of community for Sana Benefits, and this is a webinar for brokers to learn how to sell Sana. As you all can see, you're answering right now my poll. The question is basically very easy for you all to answer. It's how did you hear about us? Through your client, social media, news article, friend who is a broker, or other? While we're all waiting, I'm gonna have right now a little bit of my coffee with my Sana coffee mug. So cheers, everyone. I'm pretty sure everyone had a nice lunch at this time. All right, it looks like everyone's answering our get to know you poll. A lot of people are saying that y'all heard about us through a client. And the other one was social media. Another one is y'all heard from us through a friend who is a broker. Again, go ahead and if you just joined us, answer our simple poll. It's just as a way for us to get to know you and understand where you guys are learning more about us. This is exciting. I'm very happy to hear that your clients are telling you to check out Sana. So that says that I'm doing my job. All right. Well, I'm going to go ahead and I'm one of those sticklers that we're going to go ahead and start continuing on time. I would like to introduce our VP of Practice Leader, Justin Turner. Justin, if you could turn on your camera. Justin Turner has been with Sana Benefits for more than two for more than 2 years, actually, since an exception, and he's the one who's doing the presentation. Justin, thank you so much for joining us. Is your audio on and everything good?
It is. Thank you so much, Tony. Always always a pleasure to be introduced by the great Tony. Uh, and welcome. Thank you so much for joining our webinar. My name is Justin Turner. I'm the Vice President and Practice Leader for Sana. And I'm excited to have all of you come aboard today and learn a little bit about what we're doing, what we're trying to do to change the landscape of health insurance. Again, thank you so much for filling out the poll. A couple of housekeeping items. We will be taking questions and answers at the end of the meeting. Just knowing that there's probably going to be a lot of different questions. And of course, I do have some of my elite. Looks like I got muted. Looks like I have some of my elite Sana benefit advisors on as well that will also be helping answer some of the questions. Titus, John O'Reilly, as well as Josh. So we'll be taking questions at the end. The chat is turned off just because we want to make sure we do address everybody's questions by the end of today. But what I'll be doing is walking you guys through a presentation today about what's making Sana different and, quite frankly, gaining us a lot of traction in the marketplace, being one of the most exciting health insurance products on the market today. So today we'll talk about Sana. We'll talk about the current marketplace, which I'm sure you're all familiar with. We'll do a little bit of introduction of Sana, our benefits, how we handle transition from one carrier to another. We'll talk about some of the plans and pricing, and we'll talk about growth and our investments, a lot of what's behind the excitement with Sana, and we'll talk about next steps. A little bit about myself. I've been a broker for, pushing 20 years. I'm a CEBS certified general benefits advisor with the Wharton School of Business. I've been working with NFP, Hub International as practice leader across the country, including a very renowned and controversial name of Zenefits. I was the practice leader there. And I've taken a lot of experience in both the traditional and the insurtech space to bring a lot of really exciting solutions to my fellow brokers that are on today. Again, thank you so much for joining, and hopefully you'll find that this time together is something that is beneficial not only to you, but to your clients. How do you think of us? Well, we're competing, guys, head to head against the big four, the BUCAs. Obviously, we see Humana and a couple others up there, but our main goal is to drive a much better product and experience for the largest and, quite frankly, most underserved segment in the health insurance industry today, and that is employer-sponsored health plans. As we know, small and medium-sized business pretty much occupy the landscape of the economy, and we wanted to be able to offer a solution that was different than your fully insured models, different than your turnkey, Cigna-founded, level-funded products that we see with the other carriers, and offering a new solution. We are a level-funded product. We do run off a PPO network, which we will get into in a little bit. We do utilize reference-based pricing when needed. We also look at different, ongoing contracts. We use a myriad of different network approaches. So if you're walking out of this meeting saying Sana is reference-based pricing, you missed the boat. We are 95% of our claims are filed through our PPO network, which we'll talk about in a little bit regarding our partnership that we've taken with a national network. But just to kind of give you a landscape of where we are, where to place us, we're competing against the big boys, and for many reasons. There's a big problem. And I know I'm speaking to the choir on this one when I'm talking to fellow brokers out there that know that the industry problem is not been anything different than what we've been seeing, not only since the ACA, but before the ACA. And of course, one of the biggest problems we're seeing is obviously increased premiums at a rate of 12 to 15% across the board nationwide. And this has been, something that's not sustainable. Not only not sustainable for you as a broker to be able to manage your clients, having to market them every year to basically find more competitive and more competitively priced coverage. But to the clients, to your your employer clients, this is something that's unobtainable. It's not sustainable in the sense that how does a company budget for a 12 to 15% increase on programs that are 7 6, 7 figures large as far as a price tag is concerned. I mean, we all know, next to payroll, health insurance costs are probably second in line as far as the most expensive check they're going to cut all year. And it's just not premiums, but we're seeing a huge, decrease in the amount of benefits being offered by the BUCA carriers. Of course, we're seeing higher deductibles. We're seeing higher out-of-pocket maxes, lower co-insurance, higher co-payments, and more member responsibility being put onto the employees, which is adding to the total cost of risk when we look at the overall coverage that these United Healthcare Plan and Blue Cross Blue Shield plans are offering. So we wanted to do something about it, and that's what Sana really said. You know what? There's something we can do to make a better health insurance plan, and that's what we set out to do. But we started with really looking at customer satisfaction. We wanted to really kind of dial it back and really see how can we really make a better health experience or health insurance experience. I mean, let's face it, nobody loves health insurance. But when you look at certain products that we purchase, on a daily basis, whether it's, yes, Costco, I'm probably there on a daily basis, or Apple products, or companies like USAA that have just stellar reputations. We see that that they do certain things right. They start at the consumer and they build a product and an experience that delivers what they need and satisfies them. And we look at the health insurance community, and we're basing this off what we call net promoter scores. Net promoter scores, NPS scores, is on a range from -100 to 100, 0 being par. And what we see with health insurance companies, it's no surprise that most health insurance companies are rated right around a 0. You don't love them, you don't hate them, you need them, you realize you have to have them, but quite frankly, you wouldn't recommend them. And we don't see that with Sana. What we did is we took a lot of cues from companies like Costco, companies like Zappos, companies like USAA, and built an online experience that not only delivered satisfaction to our customers, our members, but also provided a totally different level of product and access to care that no other health insurance carrier has been able to provide until now. And one of the things we're very proud of is we keep very close tabs and very close ties to understanding what our consumer feels and what they think about our product. We did a couple of things. We looked at customer service, and we looked at how can we provide technology or utilize technology in a way that delivered a better experience that no health insurance carriers really delivering. And let's face it, if you've been doing this for as long as I have, you all know these health insurance carriers are about as antiquated as you can get when utilizing technology. And when they try to use technology, they use it in the wrong ways like using robots and phone mazes. And we decided that's a silly way to use technology to create a better member experience. And what did we do is we created a very innovative way to round robin our member inquiries and incoming calls and requests, utilizing our technology so that our live Sana member advocates that are all in the United States will answer the phones within 30 seconds or shorter. And not only that, we are being touted to be the very first technology-based insurance carrier in the U.S., meaning that we can utilize our technologies to get things done. One of the things that we do to get things done is when our members call, they're not just answered and shoveled off to a voicemail or to another department. Rather, our member advocates can get things done on that very first phone call. In fact, our numbers don't lie. Over 80% of all calls that are received by Sana member advocates departments are actually resolved on that very first phone call. And that says a lot. That says a lot. That means that your employers and their employees are being heard. And not only being heard, they're being served. And that's something that no Aetna or UHC can do in a matter of weeks. And we're doing it in a matter of minutes. And I think that's, right off the bat, when you have a health insurance carrier that philosophically is not just a premium collector and a barrier into your employees' health care, but a true member advocate. In fact, we're being also touted as being the very first carrier that is a member's first health insurance carrier. I know that probably sounds familiar with companies like USAA or AAA out in the insurance industry, where we hear that they are members first. They will go out of their way to create a better experience and to make sure that they fully represent their members to the community. That's what we do with our healthcare, our healthcare providers that we work with, is that our members truly feel that we have their back. And that's an experience that no UHC or BCBS is going to provide. And it's something that we're really trying to change the stigma and the perception that the consumer has about health insurance. And it's something that's very important to us, because we don't want to be another carrier. We want to be a carrier that's delivering a better experience with better access to care at a better price that's more sustainable year over year, which we'll talk about here in a second, than any other carrier, because this industry is not going to change unless somebody steps up and does it. And that's what we're trying to do here. We are doing things differently. First off, one of the things out of the gates, we realize, hey, we're the new kids on the block. We whiteboarded everything out, looked at everything about health insurance, about, how are we going to make an impact in an industry that is so, inundated with legacy carriers and as conditioned consumers and even conditioned us brokers on how to accept and serve and deliver health insurance. And one of the things that we see is premiums. I mean, right off the bat, number one, let's cut right to the cheddar. It's price. Health insurance, is one of the most costly expenses to not only employers but employees alike, and we wanted to address that right off the bat. Now, take this with a grain of salt, and granted, depending on the network access and of course the benefit levels, but we're on average saving our employers about 20% on premiums, apples to apples across the board. And of course, that fluctuates depending on risk. But that was one of the things that we really wanted to drive home, was to create hey, if we're going to create some sort of excitement in the industry, we've got to offer a health insurance plan of value at a lower price. Now, we do work directly with employers, but we also select very exclusive brokers like yourself that are interested in wanting to offer the Sana solution and partnering with them. We don't work directly with brokers in the same way UHC and BCBS does, where they use brokers as their primary sales channel, because quite frankly, we realize that technology and a more direct way of doing business is easier on the client and is more expedient and cuts down on cost. One of the things I do want to talk about rates is our renewal strategy. We have a very different approach and philosophy that goes way back to how Sana was created. And one of the things that's very important for us to note is that 99.1% of all claims that Sana receives are paid. Now, this is a number you're not going to hear or see from another carrier because they're trying to fight to pay as little in claims as possible. We take a different approach to that. And so if we're paying our claims at a 99% rate and stabilizing our underwriting model to where we've taken the legacy algorithms that was written in the 70s by Willis, now Willis Towers Watkins, but back in the day when it was Willis, they sold the algorithm to that basically all major carriers across the country still use to this day for underwriting. We took that underwriting algorithm and we updated it, because let's face it, the way people access healthcare, the way people understand healthcare, and how to be a better consumer of healthcare services has changed over the last 40 years. And we felt that the algorithm that underwrites and projects risk should be taken into account. And that's something we started with revamping, applying a lot of different AI and predictive modeling to really produce a more accurate cost of healthcare over a given 12-month period of time over a given employee population. And this has produced some staggering results. In fact, what we're looking at is, right around a 3 to 5% increase on average for our renewals. So we're staying in a very low renewal increase, span. And this is something that we set out to do because let's face it, we're not the first health insurance carrier to offer low health insurance rates first year, Aetna. But there's a lot of carriers out there that have done this. But it's sustainability, the ability to offer consistent pricing year over year, is something that hasn't been done. And through our claims paying process being consistent, through our algorithm being able to produce, even with high risk outliers or people with going through disease management programs or chronic conditions, we're still able to underwrite them and actually come up with an actual accurate cost of healthcare, and build a premium around that that's going to yield a 3 to 5% increase at renewal time. What does this do? Well, this really was one of the main things that we set out to do at Sana, was to create a health plan that performed at the rate of inflation. And, right around 3%, we're pretty much hitting the mark almost on every renewal there. Our retention has been absolutely tremendous with this model, because quite frankly, if your rates are only going up 3 to 5% a year and a carrier is paying 99% of the claims, and you have some of the best access to care in the United States, why would you change? And that's what we're seeing. Let's talk about access to care. We took a lot of cues from Cigna. Cigna back in the 70s and 80s, if you've been around and studied the industry, you should know that Cigna was started level funding. We're a big proponent of level funding. We run our entire Sana model off it. But we also realized that Cigna did a couple other things that was really smart. And the old Great West Network was one of the things that they did that was very smart. In fact, when they leased the Great West Network back in the 80s and eventually purchased that to become their own PPO, was something that we wanted to model after. And so we met with MultiPlan, we met with a lot of different networks, and we decided to basically break bread and really hit the market with a network that started here in Texas, and that's HealthSmart. Some of you are probably very familiar with HealthSmart. It's one of the largest privately held PPO networks in the country, offering over 90% access here in the state of Texas, and offering very rich coverage, in the states of that we're doing business in. And currently we are situs in Texas, Kentucky, and Illinois, with a few states here in the future that are probably going to open up by the beginning of next year, which include Ohio, Florida, Colorado, and Arizona. But currently we do have situs in the 3 states, but our network is national. And if you guys are familiar with the HealthSmart network, it has excellent nationwide coverage as one of our layers of networks. Now, what's very interesting about Sana is that we do not penalize members for out-of-network access. We'll get into that in our plan design. It is an aggregate, homogeneous, out-of-pocket responsibility for our members, simplifying the experience. So the double and triple penalties that members would experience in a traditional health plan going out of network is something that Sana members do not experience. The other thing is that all Sana members have access to all of our networks. We do not distinguish or discriminate network access or provider access based upon plan election. This is huge. And so when a Sana member selects a plan, it is truly selecting a plan based upon financial viability and financial responsibility, rather than I'm going to sacrifice my healthcare experience and sacrifice my access to providers and facilities that I might need based on price. That's not the case with Sana members. And so this is something that we've really taken a hard look at, and really combining not only HealthSmart, but we've also, we run off what's called a wrapped network experience. So like I said at the beginning, do we use reference-based pricing? Sure. Do we use value-based pricing? Sure. Do we use direct contracts? Absolutely. Do we have ongoing contracts? You better believe it. Are we driving direct primary care? Yeah, we are. And this is all experienced within the Sana ecosystem, so that members have the best access to care, including facilities like like the Mayo Clinic through our partnership through Edison Healthcare. And this is this gives our members access to not only children's hospitals across the country, Cleveland clinics, but the Mayo clinics as well, all within our network ecosystem, regardless of plan selection, just because you are a member of Sana. This is something that's really changing the dynamics of how people are experiencing health insurance. They're not getting tripped up over, oh gosh, I signed up for this EPO and I can't access, Baylor Scott White. Well, you can with Sana. And the seamless experience to the member is just like any other experience they would have if they had a Choice Plus plan through UHC. We also wanted to create a more than just health insurance access. As we know, we're all working from home. Yeah, I do have a Sana banner in my house. Live, sleep, love Sana. One of the things I can tell you is that, this COVID pandemic has created a very different dynamic in how we access healthcare, and quite frankly, a lot of virtual services and telemedicine services have really hit the pavement, and have been a huge solution and a great value to people, when accessing healthcare. We take it one step further. We also not only tout one of the largest physical networks in the country, but we also tout one of the largest virtual networks in the country as well. It starts with PlushCare. PlushCare was a partner, as our telemedicine partner. We vetted out, all the big ones, including, Teladoc, who started the industry. But they always say the disruptors are usually not the ones that make it big. It's the ones that come after the disruptors. And PlushCare is the first telemedicine provider to fully vet out and credential the quality of their medical providers and their network across the country. So they only select doctors from the top 50 medical schools in the US. And these are doctors that are actually specifically trained in telemedicine services. What's interesting is a lot of the healthcare community, when COVID hit, they all scrambled to practitioners in brick and mortar shops all scrambled to basically keep their shops open, and by doing so, we're jumping on telemedicine services. But let's face it, like if you're a traditionally trained physician, with seeing patients in person, all of a sudden now your practice is virtual, and you're not trained in how to do that. There's a big problem. PlushCare doctors are. So you're not only receiving some of the top physicians in the country from the top medical schools, but you're also speaking to physicians that have been formally trained in virtual medicine practice, receiving better quality of care, and getting better results. Fastest click-through rates for your members, and it is a phenomenal experience, the best experience in my regard as far as when it comes to telemedicine services. Now, we combine those with two other networks. We also wanted to address a very scary topic to talk about in health insurance, and that's mental health. One of the things that you'll find in our plan designs is we actually have 90% coinsurance on most of our plans and 70% coinsurance on a couple other of our plans for all mental health related services. But we also wanted to add a layer on that to protect us financially as a health insurance carrier, and also provide access to some really great licensed psychiatrists and psychologists that are able to prescribe mental health medications over the phone or over the app. And that's through our partnership through Ginger. Ginger is a virtual telemedicine support provider for mental health services. Fantastic addition and layer to our actual physical benefits for actually seeing a mental health provider through the actual health plan itself. Additionally, we also wanted to add a very cool service onto that called Maven. Maven has been getting a ton of reviews as being, in a lot of different health publications as being an on-demand virtual access provider for OBGYN, maternity care, as well as pediatric services. So this is a pediatric service as well as a maternity care service 24/7 virtually that your members will have access to, and it is absolutely getting rave reviews. And it really kind of completes the trifecta of our general primary care virtual services, our mental health services, and our maternity and paternity care services that we offer through Maven. Additionally, we offer a lot of cool perks that, quite frankly, add into the overall wellness experience of Sana. We have Palm dialed up. We have Matthew McConaughey and dialed up to put you at peace when things get a little bit awry. All members of Sana get access to all these services, complimentary, paid for by the plan. We have a gym membership through the largest gym in the United States, and that's ClassPass. ClassPass is the largest universal gym membership in the country, giving your members access to facilities like Gold's Gym, 24-hour fitness, as well as a lot of the local Pilates studios, spin classes, yoga studios, CrossFit if you're a little bit nuts, and a lot of local gyms, making it one of the largest gym memberships in the country. People love it. Of course, Vita Health Coaching, and of course, as I mentioned, our partnership with Edison Healthcare, providing access to our Sana Centers of Excellence program to facilities like Mayo. We're a technology company and a health insurance carrier in one. We provide online tools for employers and to you as brokers that you'll have administrative access to that's combined with the power of Think HR. This gives not only your clients excuse me, a great layer of HR resources through Think HR, but gives your employers access to be able to enroll employees, to make QLE changes, to have live chat with our Sana advocate members, to look at claim status, as well as be able to look at reports. We always say renewals are really never a surprise with Sana members. Why? Because we provide real claim data, HIPAA compliant, aggregate claim data to our members in a daily 24-hour basis so that you can actually see how well a plan is performing well ahead of time, making renewals never a surprise. And it allows the Sana account manager, which are dedicated and assigned to every account, the ability to make changes, whether it's through education or through claim negotiations, to make sure that we can better steer a plan into better performing year over year with our ability and our technology and the visibility that we provide to our actual Sana administrators and members, and so our employers, excuse me. And this just gives just a totally different experience that health insurance doesn't have to be this scary behind the scenes. Oh my gosh, we gotta wait for that scary renewal email or letter to come before we understand what our costs are going to be. We're getting rid of that, and we think this is a better way of doing health insurance. Switching is easy. Implementation takes typically 2 30-minute phone calls. One is prior to open enrollment. The other one is post open enrollment. It is all done online. It is done with a custom online benefit guide that is tailored to your employer's contributions, plan elections, and plan offerings. And so they will receive, employees will receive a notification from Sana letting them know that open enrollment is open, and that they are able to jump on their smartphone or a computer, or even go and be able to be self-served through their employer, who can actually self-serve enroll them as well. Do we have brokers that still do traditional in-person open enrollments with Sana? Absolutely. We can help facilitate for that. We can talk about that, but do know that that is the exception, not the norm. And so we've created an experience that's just simple. It's easy. Employees are able to get the information they need to understand what the difference between the different plans are being offered, as well as understanding their costs, as well as understanding their financial obligation under each plan, allowing them to make a simple election, enroll, and receive their member ID in real time. So one of the big things is, you brokers out there know, one of the big problems of switching carriers is, of course, that lull, that waiting period that takes place when switching carriers and having to get a new group ID number, as well as new member ID and member ID cards. Sana does that in real time. The moment that a member presses enroll on their app online or on their phone, they are generated a real member ID number with a virtual member ID card in real time that has their group ID numbers, as well as all the pertinent information for their RX coverage, as well as contact information and everything like that. Now, after they do enroll, the system is then triggers our fulfillment center, which then sends out a very beautiful welcome to Sana packet to all of your employees or employers' employees, and in the mail within about 10 days, where they will receive their hard plastic Sana medical ID cards, as well as beautiful information, informative information on how to access help, as well as how to access all these great perks that we offer at Sana. Our plans. You'll like this. I did. We offer 9 plans at Sana. We offer 3 HSA plans. And let me make a point here. We've done a lot of market research, both internally in the industry and externally. And I say that in helping all of us understand that, our Sana plans were very intentionally designed. Not only from a perspective that, hey, we wanted to address one of the biggest things trends that we're seeing here in the health insurance industry. And that's the simple fact that we're looking at health plans that are becoming less valuable. It's not only premiums are going up every year, but benefits are going down every year. And we wanted to address that. Most of our plans are platinum level, or 90% coinsurance or higher. We do have some plans that do offer 70% coinsurance, and that's to address the fact that we are an open access PPO network. We do not support EPOs. We do not support HMOs. Yet to price against those plans, we realize we must offer PPO plans at an affordable level and offering a 70% coinsurance to help minimize the premium load. But let's start from left to right. We do have our H-Series plans, which are our HSA compatible plans. As you'll see, they marry up very well to what we see in the marketplace. These are all 100% coinsurance plans, starting with $6,500 deductibles, going to a $5,000 deductible, and going to a mid-range HSA and a $3,000 deductible with our H30 plan. These are very cut and dry, meat and potatoes, 100% coinsurance that matches up with the deductible and out-of-pocket max. One thing I do want to point out, there is no out-of-network benefit column. Now, I'm not saying there's no out-of-network benefits. There are. But we aggregate all out-of-pocket cost into one member total cost of risk responsibility. And that's why we only see one column. So yes, if you go in network with an 865 plan, your deductible is $6,500. Whether that deductible is being met by in-network or out-of-network providers does not matter. And can we do this? We've been doing it for years and still been running a very healthy 65% MLR across our stop loss treaties across the board. So that says a lot, is that carriers for years have tricked us as brokers into thinking that, hey, if you send your members out of network, they're gonna have to pay out of their pockets, and it's gonna be costly. It's more so a discouragement to basically discourage members from going to providers that are not part of the club of their in-network providers. We can talk about more of that in the chat. I know it's a philosophical and a lot more complicated discussion to have, but let's move up the scale here. After our HSA plans, we go into our E-Series plans. These E-Series plans, of course, are essential level coverage plans. They are based at 70% coinsurance, but have very rich co-payments of $25 co-payments across the board for office visit, chiropractic care, yes, included. Acupuncture visits, absolutely included. At $25 co-payments, including $25 co-payments for urgent care visits. All plans cover, the emergency room visits at $200. And then, of course, our PBM provider and prescription drug benefits at $10 for generic, $30 for brand name, and $55 for specialty and brand name non-formulary are all covered regardless of what plan you select, either through the E-Series or our very rich 90% coinsurance S-Series, which are platinum level rated, 90% coinsurance. The only difference between the E-Series and the S-Series are 70% coinsurance to 90% coinsurance. But they all share the very rich, highly utilized benefits of $25 co-payments for primary, $50 for specialty, and of course, you can follow the grid down. The only difference between the plans from there on out are your deductibles, out-of-pocket maximums, and of course, your premiums. To just give you an idea, the E-Series, which is a first dollar out PPO plan series, is basically priced probably pretty close to what you see that 6,500 HSA plan is. Now, depending on the demographics and the risk of your group, of course, we are able to provide quotes in pretty much same day turnaround time, fully underwritten rates within about a week or shorter, depending on the size and complication of the group. But a lot of these rates, a lot of people ask, well, what sort of price ranges are we going to see that 6,000 E60 series plan? That's a 70% coinsurance, and I would say it's going to be sub 300, depending on the risk of the group. But of course, we'll talk about more information on how to obtain a quote and how easy it is to work with Sana here in a few minutes. I do know we're winding down to the end of our time together. I want to make sure we do cover everything. We do also provide ancillary benefits to our employer groups. This is something that you can utilize through us or provide your own ancillary benefits as a broker from outside carriers. But we are a full service internalized brokerage as well. Now, a lot of people ask, how do we do that and compete with our broker channels? Well, we play very nice in the sandbox, guys. We understand that you as brokers are the curators of a lot of these employer groups and quite frankly, the gatekeepers. And we want to make sure that we can provide not only a solution to you and to your clients, but also to clients that decide to go with us directly. We do have full services for HSAs, FSAs, HRAs, as well as all lines of coverage through our partner carriers, through Beam, BSP, and Principal. A little bit of a history. It was by Sana, or about Sana. It was founded by Will Young and Nathan Hackley. We're very active in the industry and with the company, and have launched this company to where, quite frankly, the adoption by employers across Texas far exceeded our stretch goals. We knew that there was a marketplace for this. We knew that there was a point that we could really address here with Sana. We didn't realize it was going to be addressed so quickly and so vastly by so many employer groups. We have hundreds of employer groups across the board that have switched to Sana over the past couple of years, and now tens and thousands of members. And in fact, we were being touted to be the fastest growing health insurance carrier in the U.S. today. We have aspirations. In fact, if you guys have been following us, LinkedIn just announced that we are the top 50 startups to work for in the United States, as well as we just announced a huge funding round, a closed funding round of over $20 million. That's basically going to be our only funding round that we're expecting to launch us on a national platform. And this is something that we're very excited about because we want to be the next big national carrier. And so far, we're set out to do it. This is pretty much the end of my presentation. I want to thank all of you. Not only thank all of you, but welcome all of you to really learn more about Sana. We wanted to do what we can to help you and your clients offer better health insurance at better prices, with better access to care, and have an overall better experience. I do have some of my elite Sana benefit advisors on the line to assist for Q&A. We're going to open up the chat and the Q&A at this point because I'm sure you have questions, and we'll give you more information on how to follow up with us, as well as some more information on, hey, let's get to it. Let's get a quote. How do you get a price, and how can we get your how can we get your employer clients on the best health insurance in the U.S. today? I want to thank you guys so much for your time. Tony, I'm going to hand it over to you.
Hey, Justin, I just launched a quick question. One of the quick questions was, what size group do you typically work with? If all our attendees, can you please go ahead and answer these questions? I did have a bunch of questions. They were emailed ahead of time, and also like right now they were sent to me. One of them, it seems that was very common. How can a broker price a group, Justin? How can a broker price a group with Sana benefits?
Yeah, very simple. We take a simple census, and which is name, date of birth, gender, and home zip code. Send that over to us to brokers or at sanabenefits.com, and we will be able to put you in contact with one of our Sana benefit advisors within that same day. And then, of course, they'll be able to turn around preliminary rates to you within about 24 hours.
Okay. The other question is, what happens when a provider like a doctor or a hospital system or a specialist doesn't know what Sana is? What happens?
Yeah.
Like, what happens if they don't know who we are?
Great question. And so a lot of times what happens, whether this is, and I just had this happen to myself, Sana is not very well known. We get it. I mean, we're the first to say nobody knows who we are. But HealthSmart is one of the most strongest household names in the healthcare community. It's one of the largest payers of paychecks to doctors and hospitals in the U.S. And so when they see that we are co-branded Sana HealthSmart, this provides a lot of comfortability and understanding how they file claims and who they contact into filing the claim. The other great thing is, hey, we answer our phone calls, and I know as you as brokers have always been proud to tout this. This is something we are proud of as well. And so if a member goes to a provider and the provider doesn't know what to do, you better believe they can call the 833 SANA 123 number. We're going to answer our phone within 20 to 30 seconds, be able to give direction to that provider on how to file a claim. I had it happen with a specialist of mine, and they thought it was super easy, super simple, and took my coverage like that.
Awesome. The other one is actually a very good question. Some people want to know, some brokers want to know, how do they get appointed? I think they were talking about their BOR. How do they get on the broker on the record?
Yes. So very much like how United Healthcare has gone through a limited appointment process, we're kind of very similar in regards that appointment obviously takes place after your first group is written. And so what we do is once we quote a group, and just to let you know, we do have some credentialing requirements and standards that are absolutely immovable in place with any new broker working with us. We're new, guys. We are very sensitive in making sure our product is represented accurately to the fullest. So any new group that you submit to us for a quote, we require that one of our SANA Elite benefit advisors to be able to will present with you to your client for your very first client. And this is to help kind of give you an understanding of how we present our product, what things we value, what things are important for us to communicate to your employer groups. But that is just for the very first group. Once your first group is closed, you'll no longer have to have a SANA representative to be able to present the final quote to your client. But you'll also be credentialed at that point and appointed. To give you an idea of what we pay out, we're very competitive, and about 5 to 7% of total premium is going to be paid to the broker representative on file. It is actually a larger percentage of stop loss premium, but it calculates to about 5 to 7% of total premium written. It's a very competitive compensation. We require that all first groups being presented final rates be presented with yourself as a broker and one of our SANA Elite benefit advisors.
And the last question, I think we're going to be wrapping this up because we just went over. Can you please clarify the states that brokers can sell SANA, and also what size groups do you got the SANA work with?
Absolutely, Tony. So we sell currently in Texas, Kentucky, and Illinois. Those are where the situs, what we say in the industry, the state that their situs in, meaning that's where they are headquartered in. Now, our employer requirements of eligibility are a lot looser than a UHC or a BCBS, so I do encourage you to contact us or reach out to us to find out a little bit more about what's going to define the actual situs status. But we are currently writing in those 3 states. We are looking to be opening up Ohio here by the end of the year, and it looks like Florida and Arizona by the beginning of next year. And hopefully be in about 20 states by the end of 2021. We are making a national push. But please note that our network is national. So if you do have employers that are situs here in Texas, but have employees in New York and California and Arizona and all these other states, that's fine. As long as they're headquartered here in Texas, Kentucky, or Illinois, we're going to be good.
And I believe
size group, just to answer that real quick, Tony.
Sure.
Our average size group is just under sub 50. We're writing anywhere about, I think it's the last numbers I looked at were right around 35, 40. We have groups as large as 400, as small as down to 5 employees. 5 is our floor. We do need 5 enrolled employees to be able to establish a group. Participation requirements are at 50%, so it gives us a lot of flexibility with manufacturers. So please reach out to us a little bit more. We can do things other carriers can't. And I encourage you to reach out to us to find out more.
And Justin, just to give you the results of our last poll that we ran, it seems to me that a lot of people work with a size group of 5 and 25, and most of the people who are on this call, they work with a size group from 25 to 75, just to give
Perfect.
you more context.
Perfect.
Well, that's pretty much it. Thank you so much, everyone. Again, this is our Sana broker presentation. Well, Justin and I, we're gonna head out. I'm gonna have some of my Sana cereal because I'm actually hungry. That's my afternoon snack. So, again, thank you so much, everyone. We appreciate your time and we're excited and happy open enrollment season.
Yes, tis the season, guys. Reach out to us. We'd love to talk.